Welcome to the final of our webinars on Prostate Progress, our new patient data platform. My name is David James. I'm the Director of Patient Projects and Influencing at Prostate Cancer Research, and it's my pleasure to welcome you all today. Just a reminder, this webinar is being recorded so we can make it available to anyone who is unable to attend. So today's session is going to focus on the practicalities of taking part in Prostate Progress. So we're going to start with a quick recap on what Prostate Progress is, and then we're going to cover off the consent form and what we actually mean by consent. Then what we'll do is we'll dig into the questionnaires that you're asked to complete as being part of Prostate Progress. We're also going to hear from a number of patients today on what motivated them to take part and why they think others should join them in signing up. As with the other webinars, there will be an opportunity for questions at the end. So if you do have any questions, please do write them in the Q&A box, and we'll get around to as many of them as we can at the end. So first of all, I just wanted to do a quick reminder, or possibly for those of you who are new here today, just tell you a little bit about Prostate Cancer Research, the organization behind Prostate Progress. So PCR, we are a research and information provision charity that is dedicated to improving and saving the lives of people with prostate cancer. And for us, really, patients are right at the heart of everything that we do, and they drive forwards our work. And our charitable activity covers really four kind of broad themes or areas. The first is our academic research. So we fund novel and innovative academic, that's biological and social research projects at institutions across the world. And these are funding work that's looking into the prevention, diagnosis and treatment of prostate cancer, and really how we can deliver better quality of life outcomes for patients who are treated with this disease. And we ensure that our research is really targeted to address patient need and identify gaps where we can maximize our impact and ensure those better treatments reach patients sooner. We also have our translational research arm, and that is known as Proven Connect. And that's really focused on ensuring more promising treatments are able to come out of academic institutions and out of the lab and really get to patients. And so what we'd like to see Proven Connect as, and you'll kind of get it from the name Proven Connect, is it's that bridging gap, that connection between healthcare providers, between patients, between investors, between industry, between academia, so that we can pave the way for better treatments to get to patients sooner. But we also know that our research alone is not enough to achieve our vision. And so that's why we have our patient projects department that looks at how we can better involve, educate, and empower people who have been affected by prostate cancer to allow them to play a more active role in driving forward changes in research, treatment, and care, and also supporting those who are affected by this disease, not only patients, but partners, carers, and loved ones, to help them make more informed decisions about their own treatment and care, to access the right information at the right time, to minimize treatment regret and improve quality of life outcomes for people affected by this disease. And finally, we also have our advocacy and influencing arm, and we really seek to ensure a greater equity of treatment and care for everyone who's diagnosed by prostate cancer. See, our vision is a world where no man is left behind, where prostate cancer can be caught early and those who are diagnosed, hopefully one day cured. So that's a little bit about prostate cancer research. So the objectives of today's session, what I'd hope that you'll know by the end of this session is really what joining Prostate Progress involves, why it's really important that we get as many people as possible involved, what informed consent is, and what the process of consent is to take part in Prostate Progress, how you can withdraw from Prostate Progress should you ever wish. And we'll also go into, as I mentioned, the questionnaires that you'll be asked to complete as part of your participation in Prostate Progress. And finally, how you can update any communication preferences should you wish to. So just going to do a quick recap again on what Prostate Progress is. Prostate Progress brings together both health data and personal experience data in one place. And the idea really is about making it easy for researchers and your healthcare team to be able to assess the full picture of your health, well-being, and quality of life. Now, the NHS holds clinical data about all of us. And the wonderful thing about the UK is it's all connected by that single number, by the NHS number. And as a prostate cancer patient, well, that will include this clinical data will include things like, your biopsy results, if you had a biopsy, any treatments you might have had, your PSA results, et cetera, et cetera. But what they don't hold, systematically, is personal experience data. And so that's things about your quality of life, really what it means to live with this disease, and what the different treatments you might have had, or really the impact they have on your quality of life. Do the side effects bother you? What happens to you as a result of these different treatments and the side effects, and what impact does that have on your kind of broader life, your mood and well-being? And so we capture this data via simple questionnaires that you'll complete on Prostate Progress. And then we link this personal experience data up with the clinical data from the NHS to help create this broader picture of the disease and the impact it has on people's lives. So we've created a participant information sheet for Prostate Progress, and that details really many of the things we've discussed in the first two webinars and also what we'll discuss today. This can be downloaded by scanning the QR code here and also going to this web address. And it's also available actually when you sign up to Prostate Progress. In fact, you're going to be prompted to read and review it before you give your consent to take part. And it details in the different sections, some big important questions. Fundamentally, what is Prostate Progress? Why is it important? What's the point of it? What does joining involve? What are some of the benefits and risks of taking part? How do we protect your data when you take part in Prostate Progress? How is Prostate Progress run and funded? And finally, some signposting for where you can go for help and support. If you haven't read it, I would highly recommend you do so. And there are links to videos and stories from patients in there as well. Now, we went into the benefits of what taking part in Prostate Progress means in the previous webinar, but I just wanted to kind of really remind everyone here that there are both individual benefits as well as these kind of wider community benefits of taking part in Prostate Progress. And these individual benefits we see really as kind of threefold. One is that by taking part and answering these questions, you may well be able to help researchers find better ways to treat and to treat prostate cancer, which may benefit you during your own prostate cancer journey. Obviously, there's also the benefit of building up this longitudinal data. So by entering this information into these questionnaires and building up this picture of your quality of life over time, you can help your own healthcare team better manage and better treat your own disease. And then there's also the personalized referrals. So as suitable clinical trials come on board, and as we move into a world of greater personalized medicine, there'll be the opportunity to be contacted about these. And with the information we hold, we'll be able to reach out to you very quickly when new medicines or clinical trials become available. And this is really a big benefit to Prostate Progress, because we know there are gaps. Some people, if you're in a really with great hospital or very kind of clued in healthcare professional, they'll maybe on top of these sort of things. But for others, maybe there's months between seeing their next appointment. This information will get this to you sooner, and this may be able to help you access better treatment and care much faster. But we also know from speaking with patients that there are these wider kind of community and really altruistic benefits to taking part in Prostate Progress. That ability to give back and help future generations is such an important driver for many. We've been told this time and time again. Patients have repeatedly told us that one of the reasons they're signing up or want to sign up is for hope for furthering research and knowledge to make lives better for their own sons, brothers, nephews, and friends. And so Prostate Progress is really one of those ways that you can use your experience and really try to help others in the future who may go through a similar experience. And we're really proud to be collaborating with the NHS on Prostate Progress. So on July 23rd, the NHS announced that Prostate Progress has been selected as the first driver project to take part in NHS England's Data for Research and Development programme. This is really important because what that means is, as a driver project, that we'll be supporting innovative uses of health data to solve real-world problems. Now, Prostate Progress is going to provide safe and secure access to the clinical data of prostate cancer patients, hopefully like yourselves, who agreed to take part, alongside that data that we directly catch from you, that you directly input into Prostate Progress, such as I said, how you're feeling, the real-life effects of your cancer and treatment. We have a quote here from Dr. Vin Diwakar, who's the National Director of Transformation at NHS England, who said, "This unique collaboration with prostate cancer research will provide new insights into prostate cancer and improve care for patients." And you see the NHS Researchers Secure Data Environment Network allows the NHS to link data and enable research at a scale not previously possible, whilst maintaining the highest levels of security. And he goes on to say, researchers will benefit from the rich picture provided from both NHS clinical data, as well as information from patients who volunteer to take part and share their experiences. I'd encourage anyone who has prostate cancer to sign up for Prostate Progress and help improve the lives of people with this disease. And that's why we're really proud to say that Prostate Progress is powered by NHS data. And Stephen Bry, who previously had prostate cancer surgery, is keen to encourage others living with the diagnosis to get involved too with this project. And he's recorded a special video for the NHS to highlight why he's getting involved and why others should too.
I am one of the 500,000 men in the UK who've had prostate cancer, and I'm joining the search for a cure. By sharing NHS patient data, we can give researchers the tools they need to learn how to treat and cure this devastating disease. Anyone who's been diagnosed with prostate cancer can sign up to share their information with the Prostate Progress Initiative, transforming the lives of countless individuals and their loved ones. Sharing my experience to help others. Powered by NHS data.
So, what does joining Prostate Progress actually involve? Well, the first step is that you'll need to create an account. And during this process, you'll be asked to read and sign a consent form. Now, this is a document that will ask you to provide confirmation that you agree to take part in Prostate Progress. You'll then be asked to complete a baseline questionnaire, which is called My Prostate Cancer Experience. And this questionnaire gathers key information about you and your treatment and care to date. And this helps us understand who is taking part, and also helps us ensure that the rest of Prostate Progress is really relevant to you. You'll then also be asked to complete a questionnaire about your lifestyle and health. This is called My Prostate Cancer Health. Now, your input here supports us to gain a full picture of your health from your perspective. Once these first questionnaires are complete, what will happen then is, depending on when you had treatment, you will then be invited to come back and complete this My Prostate Cancer Health questionnaire again. This will probably only be once or twice a year. And what this does is this helps us over the course of 2, 3, 4, 5 years and beyond, is going to help us see how your health changes over time. Frequency, as I said, you receive these depends on when you were diagnosed. You may also be invited to take part in other studies or research from time to time. And you're not obliged to take part in any of these, but the research may be something you're interested in supporting. And this all takes place online. So what I'd like to do now is go through each of those steps in turn. So this is the registration page. And you can see that there is a button here that says New User Registration. And this is how you'll begin the sign-up process. What you see here is then, once you click that New User Registration button, is the actual place where you will create that account. So you'll enter your name, an email address, and a username, and you'll sort of be prompted to create a secure password. Now, this password needs to be 12 characters long and include, like, all secure sites, mixture of numbers, upper and lower case, letters and special characters. And that's really the reason for that is that meets some of those criteria around protecting the security and data of the site. So, I know this can be a bit of a burden, and I apologize, but this is really just to make sure that we keep your data as secure as possible. You'll then be invited to read and agree to the consent form. So there's a bit of information there, and you can see that orange button here says View Participant Information Sheet. So that's where you will be able to click and read the participant information sheet. I'd advise you to take your time with that and really kind of digest that. And then there are a number of different consent questions or statements, statements that you will need to read and confirm that you are happy with what's being asked of you. So I'd like to dig a little bit more into this topic of consent. So informed consent is the model that we propose. And what that means is a study like Prostate Progress must explain in a language and format you understand what it's actually asking of you. And of course, without providing your consent, you'll be unable to take part in Prostate Progress. Of course, it's always your choice as to whether or not you take part in any research, and you can always change your mind. And that's why we ask for your consent. And also, as I'll go on to later, how you can withdraw your consent at any time. Now, we're committed to ensuring that you fully understand what you're agreeing to before sharing your permission. Your informed consent is key to our approach. And we worked with patients on developing our consent model to try to make sure that it was clearly understandable, as I said, in language and a format that you'd understand, and also that participant information sheet to try to answer any of those questions that might come from the consent form to ensure that you really understand what taking part in Prostate Progress involves. So as I said, when you ask to give your consent, you're also asked to confirm that you've read and understood that participant information sheet as well. Now, the consent form will ask for your consent across a few different areas. These are the following. Firstly, it's about ensuring we have your consent to collect information from you about yourself and your prostate cancer. And this will be via the answers that you give. But also, you'll be giving your consent to allow Prostate Progress to securely access your health records across the NHS and other organizations that might hold them. You also provide your consent for us to link your personal experience questionnaire answers to these health records in the NHS. You'll also provide your consent to allow us to use this linked data once it's been depersonalized and to use that for approved and legitimate research purposes. And for information about what depersonalization means, if you haven't seen it, I'd recommend you watch the second webinar where we really go into the process of depersonalization and how we ensure that your identity is kept safe. And finally, you provide your consent to allow us to contact you about this project and other relevant research as and when it arises. It's really important for you to know that if you remain in Prostate Progress, we will continue to collect this information about you over the course of your lifetime, or until, of course, you choose to withdraw. So once you've signed up, you're going to end up at a homepage which looks like this. So once you've completed that consent form. And as you can see, if you kind of go down to the bottom of the page, you'll see questionnaires that are relevant to you and that you might be asked to complete or that remain outstanding. This is also where you'll see any guest questionnaires or research you might be invited to complete. Now, these guest questionnaires, they're not part of the core of Prostate Progress, but you may see these on an ad hoc basis as and when there are new studies or specific research questions that you think you might be interested in or able to help with. But what I'd like to do now is talk through the first questionnaire that you're going to see when you sign up and join, and that's called My Prostate Cancer Experience Questionnaire. And this is what you'll see, and you see that orange start button. So what you do is you'll go ahead and click that when you're ready to complete it. And you'll be presented with a page which looks something like this, which really just has a bit of information on that we encourage you to read before starting the questionnaire. But really, what this is saying is what we're going to be asking you about is probably historical questions, such as when you were diagnosed, what treatments you've had, and when. And for that, many of us probably don't have that, right at the top of our minds. So we'd recommend having access to medical or clinical letters or notes during this questionnaire to help you answer these questions to the best of your ability. Then once you click next, you'll be taken into the questions. So this questionnaire is separated into three sections. There's an about you section, a your diagnosis section, and your treatment section. And these different bits of the questionnaire allow us to obviously gather information about you to help us understand who is taking part and help us ensure that the site information is relevant to you. A few of these questions will ask about things that some people feel are private, so things like your ethnicity or your sexual orientation. And we ask these questions because there is often a link between these factors and someone's health. And gathering this key information is going to help us better tailor research, understand really the impact of different treatments and different bits of care on different persons, and see if there are differences that arise because of perhaps your ethnicity or sexual orientation. We'll also ask your NHS number, or if you live in Scotland, your CHI number, and if in Northern Ireland, your H&C number. Now, the reason we ask for this is that this allows us to link your answers in these questions to your clinical data held by the NHS. And those are stored against this number, so we need this to be able to link. Without this, we're unable to create this important linkage, which is really one of the key parts of prostate progress. Now, all of the answers in this questionnaire are automatically saved, so you can pause at any point and come back and complete this. You don't have to do it all in one sitting. You also note you don't have to answer every question if you don't want to. However, there are a few questions which are mandatory, as we need these in order to know what questionnaires to ask you and information to share with you. Now, if you need to edit any of your responses once you've submitted this questionnaire, you can do so by clicking the My Impact section on the left-hand side of the screen. You'll then be taken to a page that looks like this, and you can click the button which says Edit Survey and go in and make any changes. So let's say you got the date of your treatment wrong and you found that, or maybe you've moved and you wish to change your postcode. You can do that through this Edit Survey section here. And this page as well, you'll be able to see a sort of historical record of all the different surveys you might have completed in taking part in prostate progress over the course of time. Now, once you've completed the My Prostate Cancer Experience questionnaire, you'll be issued with the My Prostate Cancer Health questionnaire. And this is broken down into three parts. Now, each part will be issued one at a time. Now, for this questionnaire, again, you're going to be presented with a welcome screen with some information that we encourage you to read before completing each of the parts. And obviously, once you click Next, you'll be taken to the questionnaire. Now, the My Prostate Cancer Health questionnaire is made up of a few different validated questionnaires. What that means is these questionnaires have been approved and checked by experts. And these are well-known questionnaires for those in this space, such as EPIC 26, EQ5D, and others. Now, those kind of names aren't really important, but what these are doing is they're focused on asking about your quality of life fundamentally. And these questionnaires have been developed with the input of patients by researchers. But of course, you might not find that every question is relevant to you, and that's okay. What this does mean, though, is we're unable to actually change the questions on these specific questionnaires. So if there is something that you don't feel is relevant or you're not comfortable with for any reason, you can just skip that question. Now, the purpose of these questionnaires is to help us build that picture of your health over the course of time. And the important thing about these being validated is it means they're accepted by national and international regulators and agencies. So when we take the data from kind of aggregating the responses from many of the people who get involved, that will allow us to make that case for, say, new treatments and resources in a way that other questionnaires or non-validated questionnaires would not be able to. The thing I'd probably note here, though, as well, is these questionnaires must be completed in one sitting. They're not particularly long each part, but they must be done in one sitting, and you cannot edit these questionnaires once they're submitted. They are supposed to provide a snapshot of your health and experience in that moment and that point of time when you submit it. Now, of course, it's really important to understand that your participation in prostate progress is both informed and voluntary. And what this means is that you can withdraw at any time, and you don't have to give a reason for doing so. And there are two types of withdrawal that you can choose from. There's a partial withdrawal, and there's also what we say called full withdrawal. Now, in both scenarios, we'll no longer get new information from your health records and other data sources about you. However, if you partially withdraw, you allow us to continue to conduct research using data you've previously given us. However, if you choose to fully withdraw, we'll no longer conduct research using any data you've given. What is important to note is that it won't be possible to remove your data from any research that was done before you withdrew. And when you sign up Prostate Progress, as I mentioned earlier in the consent process, is we ask for your consent to recontact you about a number of different things. These include sending you reminders about questionnaires, sending you news and updates about Prostate Progress, asking you about your experience of taking part, inviting you to take part in other studies or guest questionnaires, and telling you about research and clinical trials that ultimately you may be eligible for. Now, you can update your preferences on what communication you'd like to receive from us at any time, and you can do this via the emails we send to you or in your online account. The only thing you can't change is the notification of questionnaires that are part of Prostate Progress. So this is an integral part of taking part in Prostate Progress. It's being reminded to come and complete those core questionnaires, so that My Prostate Cancer Health questionnaires. Now, what I'd like to do is play you a quick video from some patients about what inspired them to join Prostate Progress. So here we go.
What inspired me to be part of Prostate Progress was the value in hearing other patients' stories.
Black men do not participate in a lot of research like this, and it's also part of my kind of advocacy to help raise awareness of the need to contribute to research that is ethical and well managed, which I think Prostate Progress is, and ultimately it will lead to better clinical outcomes in terms of trying to find a cure, something specific to the DNA of Black men. That this kind of database will help. So that's why I'm interested in joining Prostate Progress.
The other thing is, so many medical breakthroughs have come almost by accident or coincidence. And so I feel that if we are to build a community of greater sharing and knowledge around prostate cancer, then what we're also doing is giving ourselves a better crack at it, a better chance of finding cures.
My name is Junior Hashim. I've been inspired to join Prostate Progress to assist in eventually finding a cure, but prior to that, sharing experiences with others who have prostate cancer in its various forms.
Anything that can help prevent, detect, and treat prostate cancer is important, particularly at an early stage. And prostate cancer, Prostate Progress, aims to help in all these areas by bringing a wide range of patient data together to facilitate research.
And the same group of patients now, just like to share with you why for them it's so important that others join Prostate Progress as well.
Once diagnosed, it's a small step for us to help them by agreeing to join Prostate Progress and sharing our experiences and our information and data so that we can help them who are so committed to a cause to help us.
My take for Black men and people from Afro-Caribbean communities is to really think hard about joining a well-structured research program that safeguards your data and provides all the assurances around data access and data security. And once you're comfortable that it is providing those securities, then I think you should join this kind of program wholeheartedly, because it is actually protecting the future of your children and your grandchildren.
Well, in a word, I guess I'm saying that hope alone is not an effective course of action, that we all need to do something to improve the situation for men and their families, and that people from a wide range of backgrounds can play an important role in this.
I want the LGBTQ plus community to know that they're part of it and that they're welcome.
If I don't participate, then I don't think it's going to be any better in the future for male members of my family in the future. And anyone with a family should be trying to push for these sort of schemes that are going to help future male society.
Anyone with prostate cancer, in particular Black men, please join me in Prostate Progress so that we can make a headway in finding a cure and help assisting others.
So I hope you found those as inspirational as I did, some of the many reasons why people are taking part in an initiative like Prostate Progress. Now, before we move on to open questions, I just thought it would be useful to do a quick FAQ. These are some of the most frequently asked questions that we receive, and just wanted to kind of really whiz through them quite quickly. But the first one is just, why are you being asked to join? Well, Prostate Progress is open to anyone who is over the age of 18, lives in the UK, and has been diagnosed with prostate cancer at any point in their life. Now, in the first phase of the project, we're going to be working with the NHS in the West Midlands, the northwest of England, and London as we develop and roll out the linkage aspect of Prostate Progress. But anyone from the UK outside of these geographic regions, particularly as well, is able to join and share their information from day one, because as we expand Prostate Progress and the linkage into the clinical data, which will take a number of years for us to do, we will be able to then straight away, as soon as we bring the NHS trust, or perhaps where your information is held, we'll be able to bring that data straight into Prostate Progress. So we would encourage everyone, the sooner you join up, the better, and the more impact it's going to have. Of course, do you have to join? No, of course not. Joining is entirely your choice. You may wish, of course, to discuss this with family or friends or a healthcare professional. And of course, if you join, you can change your minds at any time, and it's entirely voluntary, and you don't need to give a reason for why you wish to withdraw. In terms of what joining involves, I think I've probably discussed this quite a lot already in this webinar today, but it's about creating an account, filling out a consent form, and then filling out a questionnaire about yourself and your experience, and then about your health, and periodically coming back and completing that over the course of time. You can, of course, withdraw my consent. You can, of course, as I mentioned, withdraw your consent. You can either reduce your involvement through partial withdrawal or a full withdrawal. And again, you don't have to give a reason at any time. If you take part, will anyone know who you are? No. So one of the beautiful things about Prostate Progress is people accessing it cannot identify you through the mechanisms put in place. As we discussed in the last webinar, there are ways that we will be able to recontact you, and that's because of some of the benefits of taking part in Prostate Progress. And there will only be a small handful of trained NHS and Prostate Progress or prostate cancer research professionals who would be able to have access to that information. But any researchers or third-party organizations would never be able to see who you are or be able to sort of re-identify you. In terms of the findings from this research, what we'll do is we'll seek to publish these in scientific papers and encourage other researchers to do the same. We'll always make sure that your personal details are kept confidential. No one will ever be able to identify you in any published research, and we put in place processes to ensure and to really double, triple check that to make sure that's the case. And how long will you be involved? Well, Prostate Progress, the aim of this is run for a really long time, as long as really it is necessary that we continue to fight prostate cancer. Of course, as I mentioned, you'll have the option to withdraw at any time, but we would hope that this is something that you would be willing to commit to for as long as you are able to. Who is involved in Prostate Progress? Well, Prostate Cancer Research founded and owns Prostate Progress. It's governed by a steering committee made up of clinical experts and patients. We have a list of our steering committee, which can be found on our website. And there are also NHS professionals and researchers who are involved in Prostate Progress. And as I mentioned, how is Prostate Progress connected to the NHS? Well, for number one, it has been named as a driver project of part of NHS England's Data Research and Development Programme. We're also going to be working with, as I mentioned, those three specific geographic regions, so some of those subnational secure data environment, part of that network. And so we're working very closely with different NHS organizations to deliver and make Prostate Progress a reality. Prostate Progress also does have ethical approval, so it has been submitted for ethical approval and has been reviewed and approved by the Newcastle and North Tyneside 1 Research Ethics Committee. Finally, just wanted to go through these final questions. Who can access your health data? Well, as I mentioned, approved researchers will only ever be able to access depersonalized data, and its trained staff at Prostate Progress and the NHS will be able to access personally identifiable data for the purposes only of recontacting. Will PCR ever sell or profit from your health data? So this is something we went through in webinar 1. PCR will charge approved registered researchers to access the data stored on Prostate Progress, that pooled data. And the purpose of this is to fund the ongoing operational and maintenance cost of Prostate Progress to allow this data to exist and be serviceable for research purposes. But a portion of this revenue is going to go back to those who supplied it, so the NHS. So it will be there to support the NHS, and any surplus revenue beyond those maintenance costs and the expansion of Prostate Progress across the UK will be used to support other charitable activities of prostate cancer researchers, which is in line with our vision and mission to make the world free from the impact of prostate cancer. So before we move to questions, just a quick reminder about some of these resources. I know I've mentioned them in previous webinars, but a reminder that top QR code on the left, that's where you can go and learn more about who prostate cancer research is. The QR code on the right-hand side, that's the 5 safes framework that I went into detail in the previous webinar about some of the best practice around data security. That QR code in the middle is the info pool. It's our educational platform, all about prostate cancer diagnosis, treatment, and care. And particularly for anyone who's looking for information, advice, or support and going through treatment at the moment, I highly recommend you visit that site. It's widely used across the UK and has some incredible patient stories, which would be really helpful for anyone going through treatment. And finally, that bottom QR code is an organization understanding patient data, and they have some really great resources around how patients, the views of patients, and they bring those views to policymakers and ensure that patient data is used in a way that's worthy of public trust. These are QR codes for the previous 2 webinars that are up on our YouTube channel and also on our website. If you wish to go back and watch these, you can scan these QR codes. So now what I'd like to do is open up to questions. And I see some questions coming in right now. Thank you so much. So what happens next? It's a great question. Hopefully you've now watched this webinar series. You now feel informed. What I would ask for you, if you are willing, is to go to prostateprogress.org. The website address is on the next screen. I shall show you. And go create an account, sign up from the comfort of your own home, and take part in Prostate Progress. And tell others about it too in your network. Anyone you know who's been diagnosed with prostate cancer, please help us spread the word, because we need thousands of people to take part if we're going to be able to do the research we want to do and make the difference we want to make. There's a great question here from, do you want men on active surveillance? Absolutely. Yes, anyone who's got a diagnosis of prostate cancer, no matter what kind of treatment, from active surveillance, watchful waiting, if you've had a radical prostatectomy, if you're radiotherapy, if you're undergoing palliative or unfortunately end-of-life care, you're taking part is of value, and so we would welcome your participation. This is really open to anyone who's had a diagnosis of prostate cancer, no matter at what point. And so that really is actually about over 500,000 men in the UK who can take part. So this is our call out to those 500,000 plus people who do have a diagnosis. Please do get involved. So there's a question that says, I'm registered via Facebook, because we have been doing advertising on Facebook, so thank you for that. The forgotten password link on the portal is asking for my username, which I cannot recall. What do I do now? Great question. So if you have any problems at any point, please email progress@pcr.org.uk. That's progress@pcr.org.uk. And if you email us there, what we'll do is we can connect you to the support team where they can help find your username by using your email address, or if you're locked out of your account or any other issues you have, that's where you go. So progress@pcr.org.uk if you have any problems at any time. There's a great question here. Will participants be given updates on research progress and achievements? Yes, absolutely. So that's one of the reasons why we asked to recontact you. So when there are exciting things to share, we want to be able to share it with people who've taken part. That's really important to us, and that's something that it's part of the philosophy of PCR anyway, but something also that patients who've been involved in our steering committee and patient panel really keen to make sure that we close this loop. That if you're involved, you learn about some of the successes that your sharing your data leads to. So absolutely, we want to do that, and we will do that through newsletters and other updates as we go along. There is a question around, are you able to fill out forms online? Yes, so this is currently a fully online project and platform. There might in the future be opportunities for offline, but at the moment it is fully online, and that's to help keep costs down and ensure this data can be collected much more easily and at a much lower cost than it would be if we had to collect this in paper forms all across the country. To the gentleman who's asked a specific question around his hormone therapy, I'm sorry that I'm not able to answer that for you. I'm not a trained healthcare professional, but what I would recommend is you go to the info pool where there's information about other people's experiences, where you can learn more about hormone therapy and what you might expect. And there's also signposts to other resources from healthcare professionals you can talk to and others that will be useful to you. So at the moment, we don't have any other questions that have come in. So what I will do now is go to the final page, which, as I mentioned a moment ago, is where you can go and sign up if you haven't already. You can scan this QR code, or you go to prostateprogress.org. It just remains for me to say, unless any other questions come in the next minute or so, just a big thank you to everyone who has joined in person or is watching this on demand in the future. Thank you for taking an interest in considering being part of Prostate Progress. It really makes a massive, it's going to make a massive difference, and together we can make a better future. So thank you so much. And for those of you who are here live, a short survey will follow when I end the webinar. If you just give us some feedback about how you found this, and it just remains for me to say thank you so much and have a wonderful evening. Bye-bye.